Hey, Adni fam, it is Anthony. I am truly honored today to be joined with David Theobald, who is the president and CEO of Davin Healthcare. And Dave is also a registered nurse, which is so awesome. Davin Healthcare is truly changing the game with a ton of workforce solutions. I've always looked up to Davin so much, looked up to you a lot, David. So thank you so much for being on our podcast today.
Yeah, thank you, Anthony. I'm really excited to talk to your audience and just learn more about, how it can help, support our nurses, clinicians, and the future of healthcare. So thanks for having me.
Absolutely. Well, I would love to start by just going back to the beginning. If you could share a little bit about your journey, starting at the bedside and then kind of working your way up to starting a company, and now, a very successful company, Davin Healthcare, which I mean, over 20 years, it seems like you've been building. So tell us a little bit about your journey.
Yeah, I think like much of us in healthcare as nurses, we kind of fall into things. And mine was actually by accident. Literally, I thought I was going to be a forest ranger when I was going into college and thinking about, I was actually enrolled at ESF in Syracuse and had a motorcycle accident. And it was
Mm.
that instant in time where I, got sustained a few injuries that led me to the hospital and rehabilitation. And, through that experience, through the ER, through being on a unit and seeing firsthand what nurses and healthcare clinicians do on a daily basis, it really kind of opened my eyes to a new world of healthcare. And coincidentally, when I was out and getting recovered, I ended up caring for my grandmother who was alone and she just lost my grandfather. So I spent some time with her for a whole summer and she needed some care. She just had surgery. So it's kind of those two instances that kind of, threw me into a world of being a nurse. At that moment, I was talking to my biology professor, Dr. Parati, and he said, you should really think about going into nursing. And I said, well, isn't that a field just for women? I don't know too many of my male colleagues and friends that are going into this profession. And he said, no,
Yeah.
it's a great field for men, women, all diversities. It's really a growing area. So he was actually a respiratory therapist teaching part-time. So he actually
Oh,
let me shadow him at one of the hospitals. So that's kind of where I said, no, boom, I changed my major that next semester and the rest is history. And I
wow.
just fell in love with I call it the caring science of nursing, where you really truly have a calling and you go to the profession for a reason, and a lot of that is because you really want to give back and you want to help people. And I think that's really what nursing really needs, especially today.
Yeah, absolutely. Well, thank you so much for sharing your story. I think everyone who's in nursing has some sort of backstory for, something that inspired them, some sort of calling to serve patients and to serve healthcare. It's really interesting how everyone kind of has that origin story. I think for your story specifically, it's so fascinating that you went from nursing to actually starting a fast-growing healthcare company. Tell us a little bit more about your nurse-led company.
Yeah, I think a lot of nurses are entrepreneurs at heart. I can remember working in the hospital and trying to solve problems. I don't know if you remember the show, and I'm probably dating myself, but MacGyver. You'd be in
Yeah.
at the bedside, and you're always trying to solve challenges with patients or equipment or things not working or lack of supply. So you have to be creative and innovative and think of things. When I was working, for the hospital systems, I also saw that, there was travelers coming in and working at the bedside. And I thought, wow, this is a novel idea. You can kind of pick where you want to work and where you go. And it was really exciting. And I said, well, that's something I think I really want to do. So, for me, I thought about, maybe I should join one of these, travel organizations. But at that point, I figured, let me try to do it myself. I don't know. It was just kind of a leap of faith. I had some experiences with business. My background obviously is in healthcare, but my grandfather actually wrote a book called the Young Executive Business Handbook, and this was back in the early 40s and 50s at Apprentice Hall, and I still have a copy to this day. But I just think for me that was like a sign to say, hey, you should really go out and try to be an entrepreneur and do this. And, fast forward, it's 20 years. I'm really excited that I share my journey with others. I've actually helped 3 or 4 nurses start their own businesses, and I'm really excited to continue that. I think it's an opportunity, whether you're nurses, clinicians, physicians. I think there is certainly a calling for more leaders in healthcare to have executive positions, or maybe in legislation, or public policy. It's the only way that we can help move things forward is to have people with the caring gene to really make an impact. So
Yeah.
yeah, I mean that's how I got started in the business. I've been fortunate enough where I've had a couple different businesses, and one was in actually I worked with a lot of insurance carriers doing immunizations, flu clinics, biometric screening. So that was another business that I ended up helping create and then subsequently selling in 2017. And then, in the technology front, I think one of the big things I saw is like, leasing a information system to drive your workforce solutions is something I saw as another opportunity. So we actually started another business, which is our software side that creates the technology that we leverage. Most organizations in our space lease a system or use another system to be able to do that. So for me, that was another opportunity to do something different outside of my comfort zone and be able to hire some really, really smart and innovative computer science and professionals in that space. So, yeah, I think that's the journey. I think once you're in business, and this personally, probably you're always trying to innovate and try to be creative and kind of just refresh things because the
Yeah.
world is evolving quickly and you have to change with it.
Yeah, and especially in healthcare staffing, it feels like every year there's new trends, new changes in the market, new focus areas. Um, Curious, can you just share a little bit more about what Davin Healthcare actually does? You guys have a software arm of the business, you do some staffing. Yeah, how would you describe it to a listener?
Yeah, so I mean, we are very unique in our space. So we're organization that is nurse founded and employee owned. So we're an ESOP, so which is employee stock ownership program. It's an addition, but we are an MSP, so we help hospitals of all different sizes, from 25 critical bed access to 700 bed facilities with their staffing workforce challenges. So we use the technology that we build to help manage. We have our own caregivers and clinicians that work for Davin directly, and they have, ownership in the organization and, insights to what we're doing and trends. And then we have our partner division, which is all our partners that partner with us that are helping supply. We know that the challenges within the workforce hasn't changed. We know since early onset of the shortages of nursing, we saw, I think by projection of 2030, 1.4 deficit in just vacancies of professional nurses. So we know that the need is out there. So having, Davin be in this space is important. We represent a small fraction of so many companies in workforce, and especially the MSP space, but we are, very passionate about making a difference and helping our clients find creative, innovative ways to lower cost, but also increase quality. Because I think for everyone, that's what we're trying to accomplish is getting high quality nurses and allied healthcare professionals, clinicians to the bedside.
Yeah.
And, for the healthcare facilities, they want high quality, they want good people, and they're very happy when some of these people that travel actually call that facility home someday and work there permanently. So
Yeah.
that's a big area that we like to say that we can help support is, if it's a good fit, that's great. That makes us a little bit unique, trying to help hospitals and healthcare organizations just be a trusted strategic partner in their workforce objectives.
That's amazing. What I love about Davin is I think you guys have really taken kind of an ecosystem approach to your solutions, where you really have a lot of different offerings for your clients, for partners, for clinicians. I'm curious to know a little bit on the clinician side. Like, how do clinicians work with Davin? Is it through travel nursing contracts? Is it through like permanent hiring? Tell us a little bit about that for any clinicians that are looking for, new career opportunities.
So, typically in the travel area, I think the market for, nurses and allied healthcare professionals of particular traveling is we try to find folks that, have experiences in either med surge or telemetry, ICU, all the specialties, modalities, and tee them up with, a hospital that has an open position. We actually have our workforce manager, was actually a nurse himself, and our clinical director, Kathy. So we have all nurses that are involved in the process from day one to help support, our clinicians looking for jobs, but then making sure that they're taken care of throughout their journey with us. So, and then our HR team really works hand in hand with our clinicians and our recruiters, just to make sure that they understand all the benefits of working with Davin. Not only do they understand like we have a 401k, but the ESOP is an interesting, I call it benefit for all employees because
Yeah.
there isn't many organizations in our space. I think we're the only one in the MSP space in the United States that has this offering. And, how do they get that? How do they get invested in that? And how does that help them with their ultimate goal, which is creating financial freedom? And I think that's what all of us want is to someday say, hey, I'm done working. I want to jump in the RV and I want to travel around the country. And, nurses are doing
Yeah.
that anyway, and clinicians as travelers. So we just help them on that journey. And I'm really excited to help them do that. And then pave the way for any other things they're inspired to do, whether it's travel, learn new things. We're very focused and heavy on supporting their education and, any additional certifications they're looking for, we help reimburse for, and even tuition reimbursement. So we have tuition reimbursement up to $3,000 per semester for our nurses, so up to
Wow.
6,000. So anybody that's going back for their master's, they want to, advanced certificate through any of the credentialing bodies. We just support them and what they're doing professionally and what they're looking to do for the future.
That's amazing. I think Davin of all organizations is really a leader in providing a innovative and supportive clinician experience. I'm curious, obviously your background as a nurse, but now having been a leader in the space for, numerous years, how do you find that having that support for your clinicians, your travelers, your employees, and having them not just be supported, but also, part kind of shareholders of the company, how do you feel that that has made an impact in your overall engagement and retention and being able to find like the highest quality clinicians to partner with your clients?
Yeah, I think it's a big differentiator. I think the one thing is, working through us is, it's a opportunity to learn more. Being nurse-led, employee-owned, gives them a couple of different tools that, make sure that they're feeling cared for and supported, but also listened to. I think that's the big thing that I know that when I worked at the bedside is, when they're having a bad day or, they had a difficult situation with a doctor or a patient or their family member that, there is a, support team on the other end, welcoming, conversations and listening, but also giving them guidance and mentoring along the way. There's
Yeah,
many new nurses that are out into the traveling field that they need that support system to make sure they feel like they have somebody has their back, and that's so important in today's world that our nurses, clinicians have that voice behind them, representing, but also, excuse me, supporting them, in every aspect of their career development.
that's amazing. Yeah, I
Yeah,
think it's been really interesting to see technology in this space. I think really try to automate a lot of these processes involving staffing. But I think that you said it so well as, obviously you can have technology for the software, making things more efficient, like improving the speed at which, we can place candidates and, connect folks through all of these different stakeholders. But I think still having those kind of leaders at Davin to support your travelers and clinicians, I think is so important in kind of maintaining that human touch because I think we hear that from, clinicians every day is they want support and they want kind of folks to help them be able to advance in their career and ultimately reach their goals.
yeah, it's immensely important for, healthcare clinicians, nurses to feel like they have, support along their journeys. Many of them are traveling to, places across the country, many rural areas, and, having access to, somebody 24/7. We have an on-call support line. You can get a live person if you're having an issue, or let's say your car breaks down and you can't make it to your assignment. And, things happen. Life is
Yeah.
life.
Yeah.
Um, we had a nurse that, she lost her mother before she started her assignment, and you need somebody advocating for you on the other side, making
Yeah.
sure, we're human, and people have things that go on in their lives. And at the end of the day, you need somebody that understands that and is, there, for you up the bat to help support you in any situation, whether it's clinical, personal. And yeah, it's a family. I call it the Davin family. We really open our arms and hearts to all our clinicians and nurses, and I feel that makes the Davin difference.
Yes, absolutely. I love that. One of the last questions I wanted to pick your brain on as a nurse, but a super successful entrepreneur is for any nurses or healthcare workers listening that see an inefficiency, a challenge, a problem at the bedside or in healthcare, and they have an idea or solution that they want to bring forward to the market. What would your advice be to them if they were just scared to get started or maybe didn't even know where to get started?
I think that's a great question. I see so many, nurses and clinicians, doctors that are really have a great idea and they want to, find a way to, because they want to make a difference, right? It's an
Yeah.
idea because there's a problem and they're frustrated and they're not satisfied with the status quo. And I think you see it in
Yeah.
healthcare. You think it with staffing shortages. You see it with public policy. Healthcare organizations not getting funded. They're trying to defund Medicaid, Medicare, all different things. And I think nurses that have these bright ideas need a platform to help share them. Johnson and Johnson is one organization that's out there. They bring a lot of innovation to the table. ANA, I mean, getting involved with your professional organizations is immensely important. Like I actually have this week, we're applying to a grant for innovation for workforce development and for-profit, nonprofit. They're looking for nurse-led solutions. So many of these organizations understand that nurses, allied healthcare professionals, physicians, advanced practice, we're at it. I mean, we're in the trenches. We understand the challenges. We're frustrated, and I call
Yeah.
it, you know, the great healthcare resignation. Like if we don't solve these problems, people are leaving and they are leaving. But if there's more open forums, many of them are going to be published on those channels. So I know ANA has professional workforce collaboratives where, those clinicians and nurses can come in and bring their ideas and actually find support, but also funding for startups. There's a new initiative now. I know NASDAQ is actually funding. I just wrote a recommendation letter for a college that is looking for high schoolers with innovative ideas to bring them to the forefront. And then um, the NASDAQ and Goldman Sachs is actually funding the innovation labs in New York City
Yeah.
to bring these ideas. I mean, so there's definitely a lot of ways for nurses to find ways to bring their ideas to the forefront, but bring them to me too. I mean, I'm always willing to help support, and I'm sure you two are as well as an entrepreneur yourself. Listening to those ideas, see if there's opportunities to collaborate, and maybe they even want to join our team. I've had many folks bring an idea, and they actually end up being one of our employee owners and working for the organization. So I feel very passionate about helping people with innovative, creative ideas to take them either whether it's pointing them in the right direction to an organization that can help support and find funding, or line them up with a nonprofit or professional organization that help them kind of develop that idea into a potential business opportunity, which
Yeah.
I think that's the American dream, right? I mean, that's how a lot of people have that idea of creating a business, and I think we need more nurses to have that creativity and start their own companies. I think it's great.
Absolutely well said. Yeah, I think I also talk to nurses literally every single day who have ideas, incredibly awesome solutions for a lot of complex problems. But yeah, I think there's this fear of like getting started or, oh, I don't have enough skills or, oh, I don't have the right resources. But I think nurses are, as you said, like very entrepreneurial in nature. They kind of are entrepreneurs every day they work because they have limited resources at the bedside. And they have to make do and figure it out. And that's what you literally do every day as an entrepreneur. So I think your story is just such a beautiful example of that, that you can build something really impactful in healthcare.
Absolutely. And I've seen a lot of nurses start their own workforce staffing organizations. There's quite a few that are frustrated with, what's going on and they want to do something different. And, I give them a lot of credit for taking that leap, especially now. There's a lot of, challenges right now in workforce. But I
Yeah.
do see some of those challenges actually turning into opportunities for change. So I'm very optimistic to see that, there is funding, there is a lot of momentum, and I think it's a collective where you need somebody cheerleading for you on this side that's been there and done it. And if you can connect with folks like you and I and others that have started organizations or businesses, listen, I got 20 years and we need more folks out there. They're doing what we're doing, and that's going to be part of my legacy is helping teach nurses that are interested in business. And I think that's my next journey is to really help nurses leverage technology to solve complex challenges. And for
Mm,
me, be nothing better than disrupting the market by doing that.
that's
It'll bring me great
amazing.
pleasure.
Yeah. I love that. Well, thank you, David, for everything you've done for the nursing community, for healthcare more broadly. And one to plug too that we're super excited to have Davin's jobs for healthcare workers now on Adni's app. So clinicians can find Davin on our career hub and learn more about it. You're spotlighted in our nurse founded section, which I'm really excited about, being able to kind of unify awesome, career opportunities out there for healthcare workers by healthcare workers. And also for any Davin healthcare workers that work with Davin, they get access to the Davin Rewards portal, which is powered by Adni. And it's really an innovative way that Davin is giving back to their travelers, providing kind of a single place to access resources, products, anything you kind of need while you're on assignment with Davin, you have direct access to. So just wanted to plug that and say thank you for partnering with us.
Yes, no, I appreciate it. And I got some of your merch as well. So, the being able to wear your brand and get things scrub tops and sweatshirts and travelers and tumblers, all those things are really supportive. And we love our partnership with Annie and keep racking up those points and keep bringing those ideas to the table. I appreciate what you and your organization bring and giving that spotlight and that opportunity to connect with other like-minded professionals.
Absolutely. Last, wrapping it up here, where can people find you and Davin? Where can they learn more?
So really easy. It's just just Google Davin Healthcare. There's not too many organizations out there with that name. So Davin is we have a couple different areas. There's landing pages too if you Google that, but also on your site as well. So we're highlighted there. You'll see us in some of the news outlets. We've done some publications. We're working more on publications. I'm putting out content on, evidence-based research, supporting health and well-being of our workforce. I've done some work there on wearable technologies. So if you just Google Davin Healthcare, go to our website, you'll see the open job portal. You can apply to those positions. Somebody will reach right out to you. You can reach out to me directly if you're one of those entrepreneur minds that really are looking to do something different. I'd be very, very interested in talking to you and see how I can help.
Thing. Well, everyone, definitely go check out Davin Healthcare. Dave, thank you so much for joining us. We really appreciate it.
Yeah. Oh, thanks so much, Anthony. Very, very happy to be a partner with your organization and Adni, and have a great rest of your day. Thank you so much.